Hello, Dr. H. I've decided to do a video presentation, and instead of talking basically verbatim from a piece of paper to you, I decided to spend Mother's Day with my mom, having her role play as if I were an MFT student, and she was seeking advice from me with regards to her grandson, who is been diagnosed with ADHD and has newer medication. And I will be addressing all of the questions that were asked in this assignment via conversation and role play with my mom. Both of us will be reading from paper because it's off the cuff, and what's most important is making sure that I fully can explain that I fully understand psychotropic medication for children and adolescents versus adults. Please do mind that in this role play I will be speaking more than my mom will, but that's because I want to drive home information that I know. If this was a role play that was to examine how well I interact with patients, of course I would provide them more space to talk than therapist. Okay, so here we go.
Well, I have to give my grandson medication as prescribed by his doctor, and I'm not too comfortable with this.
Okay.
But my daughter told me that you were a therapist that I could trust. So I have some questions. Is that okay?
Absolutely. Not quite a therapist yet. It's interesting that you bring up questions around psychopharmacology, medication to take when dealing with mental health challenges, because I'm actually in a class right now studying that. So do you mind if I pull out some of my textbooks and some of my notes?
Not at all.
Refer to
it'll help.
Okay, great. Because all this stuff isn't quite memorized yet. But I want to be able to fully answer any of your questions. So what's your first question?
What antidepressants have been approved for use with children and adolescents?
Okay, so there are different kinds of antidepressants. I'm going to focus on SSRIs for a moment, because I think that I'm under the impression that that's a one that's used primarily when treating depression and anxiety with children. The list here says, now I'm going to use the generic name, not the trade name.
Okay.
And if it's kind of you to allow me to practice with you saying these names, because I will stumble.
Okay.
Okay, but I just want to give you a list of the different SSRIs that are out there for kids. SSRIs. Yeah, so that stands for selective serotonin reuptake inhibitor. SSRI.
Wow.
Okay, so serotonin is a neurotransmitter. It's a chemical that's in the brain. Makes us feel happy.
Okay.
Right? And when, let's say we are petting a dog, right? And we're happy in that process. Mm-hmm. As we pet that dog, serotonin is released. Right? Okay. Or if we're watching something on TV that makes us laugh. Or if we receive a hug from our dearest friend, serotonin might be released.
Okay.
Okay? This drug, for kids and adults that are depressed, this drug, once it's released into the brain, there's a mechanism that once we're done being happy, reabsorbs.
Oh.
There's serotonin. So it's not just out there.
Okay.
Right? This particular drug blocks that reuptake.
Oh.
So that you have the excess amount of happy-go-lucky neurotransmitter kind of hanging out in the brain.
Okay.
Okay?
Okay.
Cool. So here's a list of them. Fluoxetine, fluoxamine, paroxetine, sterline, citalopram, and excitalopram. Those are a list of SSRIs that are used, general antidepressants for children.
So what other medications have been approved for kids?
Wow, there's a whole list of them. For anti-hypertensiveness, there's clotidine hydrochloride. For antipsychotic, there's Respirtone, there's Alzapran, there's Zyprodone. For anxiety medication, there's different types of benzodiazepines, and antihistamines, and atypical exolytes. For beta blockers, which you could also use for anxiety disorder, there's propranolol. For mood stabilizers, you could use lithium carbonate. For selective norepinephrine reuptake inhibitors, which norepinephrine is a different
Happy drug?
Yeah. Or happy
neurotransmitter.
There we go.
Okay.
You should be studying this with me. Is antomoxetine. So there's different types of stimulants that we could use with children too. Methylpalidine, Ritalin, that's the one that you might know. Mixed amphetamines, dextrophonine. There's all different kinds here, but here's a good list that I can definitely, if you want to know more about it and you want to take it home and research, we can take a picture with your camera and you can take it home if you'd like.
Oh, that's a great idea, but I don't know if I would even know what I was reading.
Yeah, I can understand. All right. So, it's also important, one of the things I wanted to point out to you as well, is that most of these medications can begin to be used between ages 4 and 5.
That early?
That early. Yeah, your grandson, he's a high schooler, right?
Yes.
Yeah. So, I know that there are little guys out there that are taking medication to kind of help so that they can focus in school or support with dealing with some trauma that they've had in their lives.
Okay.
Yeah. Yeah. So do you mind me asking what symptoms are being treated? What's going on with your grandson?
Well, depression, that's for sure. He's a sad young man. And anxious about things, especially new things. Very, very anxious if you ask him to do something he hasn't done before. Maybe ADHD, I don't really know what that all stands for, but that's one of the things out there that they keep saying that kids have. So he might have some of that as well.
Okay, ADHD stands for Attention Deficit Hyperactive Disorder.
Okay, well then that truly describes them.
Okay.
Yeah.
There's two types, type 1 and type 2. Type 1, you might see someone who has a really difficult time focusing on tasks at school or tasks at home, and type 2 is having that difficulty focusing in addition to also being hyper.
Well, is there such a thing as having a little bit of type 1 and a little bit of type 2?
Well, yeah. Yeah, so if you have a little bit of both, then you would probably just be considered type 2.
Okay.
Yeah.
All right.
Okay. Do you have a list of the medication that he's been taking?
Yeah. As a matter of fact, I do.
Great.
Here you go.
Let's see. All right, so these are definitely some medications that we take, that I've seen kids take when they have ADHD. The first one is mepemetine mixed salts, or Adderall.
Okay.
And that's a psychostimulant. So that stimulates him to help him focus.
Oh,
okay.
Wow. Okay.
According to my text here, my good old trusty dusty basics psychopharmacology for counselors and therapists, Adderall, or flumetine, is really good for treating kids who need help focusing during school, after school, or for evening homework, because it's a longer acting stimulant. You may see kids that have difficulty with this if they are exhibiting difficulty with falling asleep.
Oh, he doesn't have any problem with that.
Okay.
Yeah.
All right. So that makes sense that this is a good choice for him then. The next one you have on here is guanfacine 10x. 1 milligram. It's an antidepressant used for ADHD, and it helps with impulse control.
Yeah. Yes, he definitely has a problem with impulse control. He doesn't think before he acts.
Okay.
He's often sorry afterwards,
but doesn't necessarily think before he acts.
Yeah.
I was reading something. Let me just see if I can find it. Subsequent studies have further demonstrated frontal lobe dysfunction in the pathophysiology of ADHD. So when you're looking at ADHD, they're noticing that there's a diminished functioning in the frontal lobe. And there's also a dysregulation in the neurotransmitters of dopamine and norepinephrine. And I know that Adderall and 10x, flumetine and guanfacine.
That's like crazy making, because I don't understand why they don't just use the names that they use on TV.
Yeah, I really wish. I'm not doing a good job of presenting it either as being something that I'm comfortable with, because I'm not, and I apologize for that. I honestly don't know the answer, so I'm going to put a pause right here in the role play and say, Dr. H, do you know why we actually, oh wow, we're at 12 minutes, so we have to move along, but do you know why we have to use the non-generic name? We have to use the generic name, we can't use the trade name, because it just...
People can't pronounce them.
Yeah, and that's not what patients tend to memorize. They tend to
hear.
Right, exactly. So I've had a couple of patients ask me that, and I don't have a really good answer. My mom's asked me that too, and I don't have an answer. So if you could kindly write back why we need to use the names, then that would be super fantastic. It might be because it's internationally known. I know when I was studying Chinese medicine, I had to memorize the Latin names because it was an international. What was used in Sao Paulo was not necessarily what was used in the United States to describe a particular herb. So we all had to use the Latin, and so maybe it's the same thing. I don't know.
I gotcha.
All right, so
what about that picture over there, though?
Well, I'm getting there.
Okay.
Yeah. All right, so yeah. So there's a dysfunction in the frontal lobe and a dysregulation in the neurotransmitter dopamine and norepinephrine, which is what both of these medications act on.
Okay.
And one of the things that is really interesting is I just recently printed this out. It's a picture of the brain, and it talks about the different parts of the brain. Because when people say a dysregulation, a dysfunction in the frontal lobe of the brain, what does that say to you?
I have no clue.
Exactly.
Except that it's in the front.
Exactly. Well, looky here. Suppresses social inappropriate behavior. Predicts consequences of actions. Impulse control.
Huh. Can I have this?
Absolutely.
Oh, okay, this is great. This will help me understand his
what's going on.
Yeah, what's going on with him? A little bit better.
Yeah.
Yeah, see, that's regular language. I can read this. This makes sense.
The last one he has on here is Celexa, Cytoprime, 10 milligrams. And that's an SSRI, what I was talking to you about before.
Right.
Right?
Mm-hmm.
So, does that help you understand his medication list a little bit better?
Not only does it help me, but I can now associate it with which parts of the brain are actually being addressed. Because I want to understand and help this boy.
Yeah, it's important to know which drugs you're taking are treating which particular symptoms.
Mm-hmm.
So you have a clear picture of that, right?
Yes.
It's also, what's another thing that I thought was really cool is that the response rate for treating ADHD with medications that interact or interface with dopamine and norepinephrine is 70 to 90%.
70.
Of a success rate.
Wow.
Yeah. This, however, this statistic involves both psychopharmacological medication in conjunction with psychotherapy.
Oh, okay.
Okay. The psychotherapy component could help develop coping skills, meal planning, conflict resolution, and parenting skills. Yeah. So that when studies show that when you combine both, you have a really good outcome. But in particular, when you're using medication that addresses or interacts with dopamine and norepinephrine. Can I ask you a personal question?
Sure.
Is there a history of drug use with your grandson?
Not that I know of.
Okay.
Why do you ask?
Because some of the medications that he's on do have an addictive quality to them, and we just want to make sure. I know that physicians don't necessarily do a thorough background check when they ask, when they're doing an intake. Sometimes they do, sometimes they don't, and that's a question that sometimes doesn't get answered. So I just wanted to triple check to make sure that there wasn't in history, because if there was, what I'm reading and what I've learned, Adderall may not be the best choice.
Okay.
So I'm glad that he doesn't.
Okay. Oh, yeah, I'm glad he doesn't too. I'm just going to make sure that the doctor asked that question.
Okay. Maybe he asked.
Took it into consideration.
Yeah.
Before I'll make sure that. Which one is that? That's the Adderall?
Yeah.
Okay, let me circle the Adderall. I'll make sure and ask about that.
In the 10X.
And the 10X?
Yeah.
Okay. 10X.
Just triple check. I could be wrong on that, but let's just triple check.
Okay.
Okay?
Alrighty.
Student, not perfect. Still learning.
Nothing wrong with checking. I mean, that's why I'm asking you these questions, because I can see why my daughter told me to ask you.
Yeah. Yeah.
Because you're easy to talk to.
Oh, thank you.
But now I'll go to the doctor. You know, when I have a chance to talk to his doctor, I have some very specific questions I can ask.
Good.
Okay.
Has there been an improvement since he's taken his medication?
Well, not necessarily around here, not necessarily at home, but I'm getting feedback from his teacher that things are doing better at school.
Okay. Well, one of the things that is important is that, we continue taking this medication, and if it's not working, that you talk with your physician before you have your son stop taking the medication.
Oh, okay.
Okay.
So we should continue the drug?
Yeah, and it sounds to me like it is working, because there are some benefits at school. The fact that we're not necessarily seeing so much change at home goes back to that whole other component that I was talking about in terms of psychotherapy in conjunction with
the medication.
Yeah.
Okay.
So would you be interested in maybe exploring looking at some family therapy?
Absolutely.
Okay.
Absolutely.
I know of a great family therapist in the clinic that I'm working at.
Yeah.
She's wonderful, and she accepts insurance.
Oh, well, that's good, because I was sure going to ask about how to be able to pay for that.
Yeah.
But is she as easy to talk to as you are?
Absolutely.
Okay, cool.
Okay, and one last question. What's the school policy? I want to make sure. Uh-oh, is it still recording? Okay, yes. I want to make sure that all of his needs are appropriately advocated for.
I have no idea, but I sure will ask.
Okay, so here's an interesting thing in this particular article that I read that I thought was, I never even thought about it. Given the increasing use of psychotropic medications with students, it behooves schools to establish either medication policy or guidelines to ensure those medications are administered safely. Yeah, so when I was working in the schools, in Philadelphia Public School District, I noticed that was not consistent across all the schools in the district.
Oh, I'm sure.
Okay, so we want to make sure that his needs are appropriately addressed and looked out at school.
Okay.
Okay?
All right. I can do that.
Wonderful. Is there someone in this school district?
Well, his teacher. I'll talk to his teacher about that first, and then we'll see where we can go from there.
Okay, because it's important that we have a set of eyes on him at school to see if there are pros or cons or warning signs with the medication he's taking.
Okay.
With benefits of the medication he's taking. People that actually have some training on how to assess
medication
intake.
Okay, cool.
Okay.
That's great.
All right. Well, thank you so much for coming by and letting me practice this stuff with you.
Well, I appreciate you taking the time to talk to me.
If you have any other questions, don't hesitate. Knock on the door anytime.
Thank you.
All right. All right, Dr. H, hope you had a great weekend and a wonderful Mother's Day. Bye.